Hi, welcome to Functional Yoga Medicine. This is where I share all the tools and all the secrets to become a better healthcare and wellness practitioner. I would love it if you can find me over on Instagram with the handle at Dr. Connie Chung, as well as to subscribe to our podcast, Functional Yoga Medicine, and share with as many people as possible to spread spread what you learn here. And also, I want to remind you, I will be hosting a free online training called the Functional Yoga Medicine in June. So if you would look for the link below, you can sign up there so that you can be informed of the specific dates and times so you can get it right delivered in your inbox, where I'll be sharing all the tips of the trade to make you the most powerful and effective leader in your community as the healthcare and wellness practitioner that you are. So today, I want to talk about gaining powerful results for your patients or clients using functional yoga medicine. Because in the name of holistic health, many practitioners are busy looking for different ways to treat and heal their patients. However, there lacks a integrative approach that aligns and connects all the things in the modern and the ancient wisdom. So as a patient, as an autoimmune patient, I had to put together all the pieces of the puzzle that seemed very fragmented, that was divided into different specialties in the conventional medicine. And in the name of scope of practice, some of the practices were sort of hidden and undiscoverable for somebody like me who wanted a seamless integration that I can use in my life so that it's a lot more approachable and applicable for me. So I've been in healthcare or health practitioner in the rehab and nutrition industry for over 2 decades. And during this time, I've learned a lot about the systemic flaws that are pervasive in each industry. And as a young practitioner, I've been told time and time again what is within my scope and what's outside of the scope, and was deterred from integrating all of it because they didn't want to see me integrating anything. They encouraged everyone, healthcare practitioners, to walk along the lines, right? And this is mainly to separate out the specialties so that we have domains over certain areas of healthcare. It's really for egotistical means for each practitioner types than it is serving the patient. And the problem is that each industry exists only as a piece of the bigger puzzle, but the piece of the puzzle can't serve its true purpose without the other missing parts of the puzzle. So that's the conundrum, right? And that's the medical system in a nutshell. Each piece only exists with the dogmatic view that it stands on its own, when in reality, it can't exist without the other missing parts. The flaw in the system also is perpetuated by the division of each industry, so much so that there's a turf war on what the boundaries of each industries are, even within the conventional medical setting. For example, a physical therapist cannot give nutritional advice, and a nutritionist or the registered dietitian cannot give physical rehab advice because it's considered outside the scope of their practice, despite the need of the patient. Same is true for the medical system. Endocrinologists won't give digestive advice, and GI doctors refuse to give endocrine advice. They are separated by their training versus looking at the patient as a whole being. And as I said, this ego-driven practice of healthcare is why we have such a problem in our patient population today. Increasing numbers of patients are sick with autoimmune conditions and chronic illnesses. I, for one, have experienced the medical system as a complex autoimmune patient, and the truth is that there is a clear divide in the medical system based on the physician's expertise versus making me feel whole again. When in the hospital for over 2 weeks recently, just a couple of months ago, I was seen by a nephrologist, rheumatologist, and an internist, GI docs and hematologists, physical therapists, and oncologists. I felt so fragmented and broken while the experts were only focusing on their piece of the puzzle, not even thinking to put the pieces back together. I wasn't addressed as me, but I was addressed as the lupus patient with these symptoms, right? I was just a number. My autoimmune condition was overseen by my rheumatologist. The kidney issue was overseen by my nephrologist, anemia by hematology, constipation in charge by GI doctor, and the internist was making sure I had all the meds to manage all the symptoms. It was far from healing, in my opinion. It was simply symptoms control enough for me to be discharged to go home. Home was where I began to recover. I was on my own in terms of healing. And this is something that most patients have to realize. In the hospital, under the care of all the experts, I felt so broken into pieces, while I myself felt so sick every day. I wanted to know how the kidneys affected my anemia and how anemia makes my thyroid issues worse and how my thyroid issue can cause my kidneys, and none of the experts, none had answers for me. None of them wanted to put the pieces of the puzzle together. They wanted to stay in their own lanes. In fact, they dismissed my question and responded with, "It's not my area of specialty, and I'm not trained to answer that," and asked me to refer the question to whoever the specialist was. This made me really uncomfortable. But in retrospect, it makes sense. As an autoimmune patient, my one goal was to get well by supporting my body to heal naturally. So I sought out functional medicine, functional nutritionists, exercise programs, which included yoga and Pilates, and tried every diet under the sun, including supplements to help me heal naturally. I, as a patient, was responsible for my own health, and the experts responsible for managing my symptoms. And this is something most patients don't understand. They rely on the conventional medical practitioner for their health. And as a patient, I needed to understand this divide so that I can be clear on how to navigate the medical system to suit me the best. And this is why I created functional yoga medicine, because I had to put the pieces together for myself to where it made practical sense for me to finally get well and stay well. It was a plan, a paradigm, as well as a blueprint for me to follow. With so much abundant information out there, which all has valid evidence, both scientific and anecdotal, it was up to me to implement them in a way that made sense for me as a patient. And because patient compliance is so much about the patient's willingness and commitment versus the experts recommending their treatment protocol. The number one obstacle to healing in the conventional medical setting is that the foundation by which a disease is treated is all wrong. They take an upside down approach, starting with the expertise of the physician or the practitioner, and try to fit the patient to their trained program. I, as a physical therapist, would consider everything to be musculoskeletal. I, as a registered dietitian, would consider everything to be diet related. It's like trying to fit a round peg in a square peg. It's like trying to fit a round peg in a square hole. It's always out of place, and we continue to try to force it in. It may work short term, but it's not the long-term solution that it requires. So functional yoga medicine has 4 essential elements that serve as the corners to the very complex puzzle. Number 1 corner in the left corner is the inner awakening. Right upper corner is outer manifestation. Right lower corner is the modern medicine, and then the left lower corner is the ancient wisdom of the puzzle. And then there is the 3 pillars of each that connect all the boundaries, or the foundation, or the frame of the puzzle, okay? And each element has its 3 pillars, which makes up 12 pillars total, okay? So inner awakening includes the foundation, alignment, and core, which is up at the top, and then down to the sidebar is the outer manifestation, going down polarity, breath, and balance, and modern medicine, which has 3 components: stress, gut, and immune, ancient wisdom, yoga, energy, and meditation, which serves as the pieces on the left wall of the puzzle. Each element with each pillars provides a complete framework for optimal practice. We've also included the business mastery module to help our practitioners leverage the online platforms to also scale their business in ways they couldn't imagine possible without the support. So if you're interested in finally having all the pieces of the puzzle, whether you finally have the practical solution for patients, where you can finally have the practical solutions and the blueprint for your patients, I want you to look no further. And I want to also let you know and invite you to a free training in June on functional yoga medicine where everything comes together. So I want you to click on the link below to get waitlisted on our comprehensive certification today. You can find me on iTunes with functional yoga medicine, as well as on Instagram at Dr. Connie Chung. Subscribe to my YouTube, Dr. Connie Chung. And I want to thank you for being here. And I would greatly appreciate it if you can give me some feedback on this episode, as well as to share this information with as many people as possible. And please, please, please join me for this free training that you don't want to miss, where I will be sharing so much with you on the framework of the functional yoga medicine that ties all the broken pieces of the puzzle in healthcare today together in a way that makes practical sense for your patients. Thanks so much. And I hope you have a wonderful day and be a powerful practitioner that you are.